When Dr. Dorothy Smith, founder, president, and CEO of Consumer Health Information Corporation, was growing up in Canada, she had many career choices, including fashion designer, chef, concert pianist, and pharmacist. She chose pharmacy, and for the past 30 years, Dr. Smith has tirelessly advocated the need for patient education and safe medication use.
My parents had always taught me that it didn't matter what career I went into, as long as I helped people. And I felt that in pharmacy, I would be helping people.
After graduating from the University of Saskatchewan, Dr. Smith came to the United States to enter the Doctor of Pharmacy program at the University of Cincinnati.
When I graduated from pharmacy, I was taught never to answer a patient's questions. I was to always refer them to the doctor. And it just didn't make sense to me that I was a pharmacist. And I'd studied, I'd gotten good marks. Why couldn't I talk to a patient?
In the mid-1970s, Dr. Smith established a first-of-its-kind ambulatory care practice in Toronto, where all patients were counseled in private rooms by pharmacists and given written information about their medicines.
She is motivated by really one thing, and that is what is the right thing to do. And in her heart of hearts, she has, from the very first moment she was in pharmacy, understood that the consumer can only use medicines well if they are equipped with the knowledge to do so. And that her job, beyond anything else, was to make sure that they were equipped with the information that they needed.
Early in Dr. Smith's career, she found she had to write her own patient medication information sheets, as none were commercially available. That work was compiled into the Medication Guide for Patient Counseling and became a core text for nursing, pharmacy, and medical students in the United States and Canada. Dr. Smith subsequently published the Family Reference Guide on prescription drugs for consumers in both countries.
I never planned to ever write a book. When I was at the University of British Columbia, I found another rheumatologist that would let me counsel his patients. And so every time before I counseled a patient, I would sit down and write up my little crib notes. And one day he saw me with these little index cards in my hand, and he grabbed them out of my hand. He said, "What are these? Are you giving these to my patients?" And I said, "No, those are my crib notes so that I tell all your patients the same thing." He said to me, "Well, then why don't you publish this for other doctors and pharmacists to use?" And I said, "Well, that's a good idea."
In 1980, while serving as the APHA's Director of Clinical Affairs, Dr. Smith edited the Handbook of Non-Prescription Drugs, now in its 16th edition. Soon after, she provided the leadership which led to the establishment of the National Council on Patient Information and Education.
Working with Dorothy is an experience, and it's a very positive experience. It's one that's sometimes challenging, but it's always meaningful because she's a stickler for detail, and she's a tremendous advocate for the pharmacy profession. So you have to be very adept at what's happening within pharmacy and the role that pharmacy plays in safe medicine use.
In 1983, Dr. Smith founded the Consumer Health Information Corporation to help patients take their medications safely through patient education and adherence materials and programs worldwide. It is now the leading producer of not only FDA-approved patient package inserts, but also materials on clinical trials, new drug launches, device instruction, and consumer awareness programs.
You know, overall, I was most impressed with Dorothy's desire to understand everything that we did. She did that in a variety of different ways, but she really had a great desire to understand our business, our audience, their needs, and certainly the issues of the problems that we were facing. Our first project together was with the Upjohn Company a number of years ago. This piece was called The Path to Healthy Living, and it was designed for diabetic patients to help them comply with medication, but also to help them with diet and exercise. Clinicians ended up loving this piece to the point where it became our #1 piece that was delivered to them through our salespeople, and we literally went through millions of copies of that piece in a period of about 3 years.
Product managers and VPs of marketing and development at the drug companies knew that there was something out there that they needed. They didn't know who did it, and really nobody else was doing that at the time, and Dorothy was really filling that need, and filling it very well, filling it very efficiently, and in a timely manner.
Dr. Smith also is committed to teaching the next generation of health professionals and she conducts a patient education and drug information clerkship elective that is affiliated with more than 40 schools of pharmacy. Her summer internship program includes students from pharmacy, nursing, medicine, marketing, business management, and graphic design.
I think my experience at Consumer Health will make me a better pharmacist in the future. It will enable me to relate better to my patients and help them with whatever condition or problem they face.
Dr. Smith's efforts have paved the way for both patient and provider understanding of the safe and effective use of medications, and has served to protect individuals and entire populations of patients whose health has been improved as a result.
Ultimately, Dorothy just wants to help people. She always has wanted to, and will always continue to. She wants them to be well.
Thank you, APHA Foundation, for acknowledging the treasure that we all have in Dr. Dorothy Smith. Dorothy, it's been an absolute honor and privilege to work with you on many projects. I'm just delighted to say congratulations on receiving the Pinnacle Award.
We are pleased to honor Dr. Dorothy Smith with the individual category 2010 APHA Foundation Pinnacle Award.